Well, good morning, everybody, and welcome to this session on the innovation challenge that we're running with South Tees Hospitals NHS Foundation Trust. The webinar today is intended to give you a bit of background on the challenge and how we'll be going about screening submissions from local businesses against that challenge. The session's being recorded and we'll be making it available online. So please just bear that in mind. If you're asking any questions or anything, then please be aware that this is going to be a public piece of material. And very pleased that we've had the support from the Trust and from Health Innovation North East and North Cumbria in pulling this together. So I'm Simon Green, I'm CEO of Edge Innovation, and for anyone who hasn't come across us before, we're a specialist design and innovation consultancy based in the northeast of England, but working across the world on projects with big multinationals through to local small businesses and startups and public authorities such as NHS trusts alongside those, as well as the universities' work that we do. And we focus on areas where there's an overlap between organizations and where we think there's a value in collaboration between organizations. So it's about opportunities to bring organizations together to collaborate on projects, for example, through open innovation projects where we have big organizations and smaller organizations working together. It's about connecting organizations with their customers, clients, and users through the human-centered design work that we do. And it's about trying to get ideas to market through testing them out with customers and developing them in as lean a way as possible, removing risk and speeding things up. So we're really interested in around how we can encourage collaboration to develop new ideas and get them to market. And that's where the Tees Valley Innovation Challenge comes in. So it really is about those relationships between organizations to come up with new ideas. And we're doing it with support from Tees Valley Combined Authority. There's a bit of information on the screen and in the next slide, but mainly it's on their website. So if you search up Tees Valley Combined Authority, you'll find all the objectives and programs that they're running. Fundamentally, the Combined Authority is there to secure investment in the local area, to create jobs through business growth, and to ultimately transform Tees Valley into a place that's even more successful and where people really want to live and build their lives. Within that, Tees Valley Combined Authority is responsible for delivery of UK Share Prosperity Fund monies within the region and has some significant funding, particularly against the supporting local businesses strand that we're talking about today, to ultimately achieve those objectives of driving investment, of supporting business growth and transforming the Tees Valley. And as I say, there's a lot of information on here, but it's all also presented on TVCA's website if you'd like to have a look at that separately. So what is the Tees Valley Innovation Challenge? We want to use our design innovation expertise to help strengthen innovation's maturity in Tees Valley through working with ambitious, innovative businesses to unlock growth in the region. We do that through direct support to businesses and social enterprises being a big part of what we do as well. We do it through building a skill base through innovation and design thinking training. We do it through publication of challenges with big organizations who want to work with smaller companies. And we're doing a lot of work around connecting people and promoting this part of the world as a center of innovation, particularly through a big showcase event that'll be happening in March next year. Our focus is on large organizations with some kind of presence here, and then with smaller businesses and social enterprises who might end up working with them and developing new ideas. So within that, there are no necessarily hard and fast rules, but generally we define things as under 250 employees and less than £50 million turnover. We're delivering a number of routes to support. As I said, we're providing one-to-one support as well as the challenges. And through that, we're able to provide significant grant funding to local SMEs to help them develop and commercialize their ideas. Overall, we're running 10 challenges, and we're looking to get 30 SMEs through that challenge program in response to those 10 challenges. We're working with another 30 companies through the one-to-one support, running a series of design training and innovation training sessions. And then, as I mentioned, there's the showcase in March 25. More information on that is available on our website and through signing up to the Edge newsletter. In terms of innovation challenges, it's about how we connect the smaller businesses, the solution developers who have got clever ideas, got good responses to some of the challenges, with the challenge holders, who are these bigger organizations from public sector or private sector who are looking for solutions to issues. As I said, there'll be 10 challenges across 7 themes, and then we've got grant funding and a significant amount of support that we can wrap around solution providers to help them develop and implement their ideas. The solutions to those challenges, they could be physical products, and as in this challenge today, I think that's most likely, but they could also be services, they could be revised processes that can be implemented by the challenge holder. The challenge themes. So today we're talking about healthcare, but we're also running themes around digital innovation, net zero, social enterprises, transport and logistics, which is a big sector for the region, professional services, and innovation in creative industries. And there are, I think, 6 challenges currently live on our Edge website, which you can have a look at, and we'll send a link through in the chat later on in this session. The process we go through is we publish the challenges, as with this session today. We then invite SMEs to put together a very brief response to show why they might be the right organization to respond to that challenge. And we're not expecting a massive amount of detail. It really is just an expression of interest level. We select 3 SMEs against each challenge and award them a small amount of grant funding to develop their idea to a pitch back to the challenge holder in a couple of months later. At that stage, we can provide 1 SME per challenge with £10,000 of grant funding to further develop their idea and work out how they would continue to engage with the challenge holder going forward. The expectation is that they wouldn't only work with that challenge holder. So if we can solve a problem for example, a big professional services firm, that problem might be present in many other professional services firms. So we can apply that product, and the SME gets the ability to apply that product to lots of different customers and grow their business accordingly. Ultimately, we want to achieve is partnerships between big organizations and small ones, and helping those smaller local organizations to develop new products and services that will help them to grow, help them to employ more people in the Tees Valley. So, as I said, on this challenge, we've been working on healthcare innovation, and we've been working in a partnership with Health Innovation North East and North Cumbria. So I'd like to welcome Dr. Rasti Nazim, who's going to talk through Health Innovation North East and North Cumbria and how we're working on this challenge.
Thanks, Simon. So I'll just give a brief overview of health innovation and what we do and how we can help support the challenge. Next slide. Yeah, thank you. So what are the health innovation networks? So there are 15 of us across England, and we are essentially established by NHS England to spread sort of health innovation at pace and scale. So we work with healthcare organisations and smaller businesses to support the spread of all types of innovation within the NHS, from new technologies to ways of working, and also to service improvements. Our ultimate goal is to improve health and generate economic growth across the nation. And we're seen as the innovation arm of the NHS, and we're commissioned by NHS England and the Office for Life Sciences. Next slide, please. So what do we do? So we focus on 6 key areas, and we work with our member organisations, sort of including the NHS trusts and universities, as well as the regional life sciences sector, to identify, evaluate, adopt, and disseminate transformative innovations. We're seen as the honest broker to facilitate collaborations between academia, health and social care organisations, third sector parties, patients, the public, and healthcare industry members to improve population health outcomes and generate economic growth across our region. And we do this using our innovation pathway. So we commission delivery partners from the regional healthcare infrastructure to support us in provision of these services. So we'll just briefly go over the innovation pathway. So this is sort of the Bible of what we do, and it underpins a lot of our work at Health Innovation. So we have 5 key gateways, and innovators and developers can come to us at any stage of this pathway, and we can facilitate with sort of an array of different pieces of work to help kind of build a case to get the products into the NHS. So particularly with this idea, as it's sort of, idea development stage, we definitely help with sort of the gateway 2 areas of, getting the feedback, value proposition, prototype, sustainability, and the PPIE. And then sort of the next steps from then on would be, the evaluation, commercialization, and then the spread and adoption. So yeah, we'll be supporting sort of this healthcare challenge throughout. And then I think it's over to Dave to introduce the challenge.
Thank you, Rusty. So my name's Dave Ferguson. I am a paediatric orthopaedic surgeon working in the Northeast. I'm also the Director of Innovation at my trust, and I'm the lead innovator on this particular health challenge. So just to give you a little bit of background to South Tees Hospitals, we are an adult and children's major trauma centre. We do a lot of operations on children in orthopedics, and one of the problems that we encountered was applying hip spicas in a timely fashion by skilled technicians. Hip spicas are a way of immobilising a child's leg after fractures and after surgery, but it's a very specialist technique, the training of which needs some special attention. And we found that there was a problem with training people up to the adequate standards using traditional methods. Nationally, we found that this was also a problem where the pool of individual specialists that are able to deliver this type of specialist plaster on a child was lacking, and that there was a lot of people that were being de-skilled because of the numbers that they see maybe declining in certain areas, and trying to keep up the skills was a big problem. So moving on to the challenge context then next. So what we wanted to do was to be able to help the trust develop a fully functioning prototype which allowed people to practice trying to perform hip spicas in their own environment. And if we had a training model to do this, then we could give people feedback. We could allow them to get on and train in their own time. We've done that. We've developed a prototype. It's fully working, but it's a bit rough around the edges, and we need a bit of help developing it to the next stage. The advantages, though, are that this is something that is probably not just a local problem, a regional problem, but it's a global problem. So there are people putting on hip spicas all around the country, all around the globe. And so if we can solve a bit of this problem, it might help other people in other areas, in other countries as well. So it's a big challenge. So a bit more about the design of the challenge, the hip spica problem. So in a nutshell, the problem is here that the hip spicas require expert knowledge, and it's important to put the spicas on properly so that we avoid complications. The complications with a plaster that's applied incorrectly can be devastating for the child. It can be that they have plaster sores or pressure sores, ridges in the cast that cause irritation. And these casts can last on a child for 6 or 8 weeks at a time, sometimes longer. So you have to get it right and perfect the first time. So if you get problems, then you increase the burden on healthcare and resources and costs, and extra time and effort, and child coming back into hospital, hospital journeys, and so forth. So these procedures, although globally and nationally happen a lot, in individual centres, they happen less frequently. And so if you have a big gap of time between applying one and then the next one, that's areas where people can de-skill. And that's a big problem when certain centres do a few and then there's a big period of time. So having a training system, a recognised, validated mannequin or model that you can train to put spicas on is a real bonus. So the current training scheme is quite intensive because it requires time off work. It requires going to certain casting centres to learn how to do the technique. And the actual time given to putting on a hip spica in the training sessions is usually limited to a small session as part of a broader teaching program lasting over a couple of days. And there aren't really any other courses to deal with this particular problem. Another technique for training is hands-on technique, where you accompany someone like an apprentice and you learn the skill. But again, that requires being in the right place at the right time. And then people who want to learn the skill but then move on might not have that particular opportunity at that particular time. So independent training will help to increase the number of people who are skilled in putting on the hip spicas. So that will suddenly upskill a huge workforce and make the whole process a bit more efficient. So the current state, as I say, is time-intensive training due to the complexities of how you apply these. The initial training is usually in person at a training centre, and that requires time. There's also the apprenticeship model, as I said, that requires people following and learning as they pick it up. But occasionally, when you go away to centres and you learn a particular technique, as you go back to your original centre where you're going to apply these hip spicas, they might be done a slightly different way. And so there are variations in the standards and how you actually apply the hip spicas. Low frequency practice, again, as I mentioned, that's a big problem to keep up the numbers. And this is a high pressure learning environment where you don't want to be learning for the first time on a real patient. You'd rather learn beforehand and then get it right so that you know that the skills that you're applying are going to be the best they can be, because time is precious, theatre time is precious if this is being put on in a theatre environment. So an independent training model would address a very big work-life balance. It would allow the training to occur at and when the time of the trainee is suited best. Flexible practice frequency, so they can utilize downtime, so that if they have a morning session where they've got nothing to do, or that they have a low volume of patients, then they can switch to training and they've got something that they can be getting on with that's quite productive and can form part of their CPD. And it can be a controlled learning environment because it will allow them to make their mistakes on a practice rather than the real thing, and then they can reflect on their techniques and by iteration improve what they do. The treatment outcomes for patients, well, ineffective spica application, it causes those significant complications that I mentioned earlier. It can be pain and discomfort. It can be difficult with feeding, inhibiting growth, because if the spica is too tight around the tummy area, there's no room for food to get into their tummy. They need some stretch room there. That can be stressful. The child might not be sleeping very well. The spica might break if it's not made robust enough. And for instance, when you're treating femoral fractures, as the fracture starts to heal, the kid wants to get more mobile, they bash their spica around, and that can cause it to break. And that can mean they have to come back into the hospital environment to get it repaired or patched up. And ultimately, what you're trying to do is protect something inside, and if that happens, then your treatment might fail. But of course, the people who are looking after those children, their parents and carers and guardians, they have to take time off work, which is sometimes actually really difficult. So the more appointments that the children have, the more difficult it is for the parents to have that time off from work. And there's the travel expenses, and there's parking at hospitals, and the whole side of caring for that child that has to be factored in. So we hope that this innovation would improve hip spica training to decrease those risks of complications, and that would be a measure of success. It would be reducing the treatment times maybe, and also having better pain relief and less stress for the child. So at home, if you have a spica that's made incorrectly, it can be quite difficult for the child. So they might have to have an awkward way of sitting. They might not be able to fit into car seats. They might have problems eating food sat near a dinner table into a high chair. So those kind of factors sometimes can make it into the way and design and application of a hip spica. So not only are you protecting the legs and the hips in a certain way, but you're also allowing the family to be able to adapt and accommodate to that treatment choice. The waiting times due to reduced number of competent staff can also increase. So if you are waiting for a particular member of staff to become available who knows how to put on a hip spica, then that means that the treatment is delayed. Whereas if you have a bank of skilled technicians in an ideal world, then that resource is upped and treatment can happen sooner. So next slide. So the efficiency on training. Well, plaster technicians are required to use a significant amount of their limited training time to attend courses. The training time they get is very valuable, and time off site is also difficult to come by a lot of times in a lot of trusts. So if you can deliver something in their own working environment, that is a massive win for the trainees and for the trainers as well. And it means that your service can be more productive. The variation in technique is quite important because when we teach things, we like to teach standard techniques, but there are individuals and circumstances where particular styles of hip spica, for instance, may be preferred. And if you have a training system where you can standardize the spicas that you give in your center, and there's less variation, then usually you can improve the results. But you can also share techniques with other centers based on something that you've developed and a skill and a style that works best. So it's sharing good practice. So the training standards there, which we've just touched on really. The current training allows an apprenticeship model where trainees are mentored by experienced technicians, but the standards vary, and this whole system may be able to simulate real life training and bring about less variation, but an overall raise of the baseline to say what is the best practice. The number of hip spica experts, we would hope that then would start to increase because we see that as a risk for service as in general, is that there are less and less people that are skilled in this. But if we had the right training systems now, then that we're going to increase that skill base. So progress, quality of care. So we would hope that we would reduce the wait times for treatment. We would improve patient outcomes. We would hope that this would cause minimal risk of complications. Shorter periods of treatment, reducing the stress for patients, and easier home care for patients, meaning that there's reduced hospital stays, there's less people coming back into hospital for complications. If we've made the system more efficient, then it's easier to evidence those kind of training standards. Ultimately, trusts also do have litigation costs associated with complications. So as soon as you start to decrease the amount of complications which are avoidable, like plaster sores and pressure sores in a lot of cases, then the litigation costs will go down, which will also help to justify such training. Reduced healthcare costs due to complications there. Minimal waste in training materials. So the more efficient you become, the less material you need to use. And that's always good for the environment, especially with carbon footprints and travel for training centres and hospital journeys. So this is to describe what we would see as being in and out of scope. To start with, what we're not looking for, we're not looking for solutions that go beyond focus on casting specific to the hip spicas. So this is just for paediatric, that's children, hip spicas. And we're going to use the standard casting material, so we're not looking at new materials in this call. And we want this to be a practical product, not a virtual product. So we're not looking at using virtual reality, mixed or augmented realities. So what we are looking for is a design development, really, of the prototype that we've got, but to make it even better than it is. And to do that, there are a few requirements to make it sanitary, so that it's compliant with the infection prevention, control, cleaning. It's got to be adaptable so that we can suit training for a number of different sizes of children, small and large, depending on the age. The majority of children are infants, I would say, so either infants or juniors that would have a hip spica on, but mainly on the infant side. And it's got to be suitable for independent practice. To make this really fly, we need people to be able to use it in their own time. So it doesn't need two people, it can just be one person using it on their own. And it needs to be compliant with validation by various bodies to give it the recognition. And that can be the British Orthopaedic Association, the British Casting Society. And mostly, a solution like this needs to be scalable, where it can be applied to the global market. Thank you.
Thank you. So hopefully that gives you an introduction to the challenge. If anyone's got any specific questions they wanted to ask today, then we can pick them up, or we can pick them up offline if there's anything you wanted to ask about as to whether your solution might be suitable, or whether there are any concerns around how we're approaching this. From a practical point of view, as I said, the expression of interest stage is a really simple process. We're not expecting people to put forward their whole solutions at this point, because part of the process is co-developing the right solutions to the challenge. But we are looking for people to get back quite quickly in terms of that expression of interest, so that we can select those organizations that we want to work with, connect with the trust, and start working through some of the detail. So early October, we're going through that process, and then leading through some development work, some grant support, and support to be able to lead into pitching back to the trust before Christmas this year, which then can lead to more grant funding that will take you through a bit further in the development cycle through to early 2025. So, yeah, thank you, Harry, for putting that in there. And I think the link is now in the chat if you wanted to have a look at that and put in a submission. If there are any questions now that anyone wants to pick up, then please do just drop them in the chat. Otherwise, we'll close the session for today. This challenge, all the information on the challenge and some further background will be available through the Innovation Challenge link that's in the chat. And we look forward to seeing your submissions come in as you work through your ideas. Thank you very much to Rusty for connecting with us on this challenge and helping us with the development of this challenge, and to Dave and the trust in terms of working with us on pulling something together that we can get out there and get people to respond to. So there was a quick question, Dave, I don't know if you can help with this. It says, are there any pictures of the current prototype? I don't know whether that's something you can share or whether it's something you could provide to us and we can send out.
Yeah, I think that will be possible. We'll supply you with some technical pictures. I think that should be okay. I'll check with Sharon, but I don't see any particular issues with that.
Okay. So Richard, I'll pick that up with you separately. Okay. Well, thanks very much for your time, everybody. I hope you have a good day, and we'll let you know as soon as all the information and the recording of this session is on the website. Goodbye.